molecular specialist in International Foundation Against Infectious Diseases in Nigeria. He is also play a role as academician research advisor for Young Medical Laboratory Scientist Forum of Nigeria. He is currently a lecturer at Staffordshire University. He teaches biomedical science, and also he fosters and supports students by learning and teaching them and improve their skills. He also plays a role in supervising students in the research projects and also developing engaging teaching materials in clinical microbiology and infectious diseases. Thank you very much, Dr. Leonard, for joining us today. And the stage is yours. You can start.
All right, yeah. Good afternoon, good evening, and good morning. My name is Dr. Uzairue Leonard, like was mentioned. So my role today basically is to, I will just share my screen so that we start the discussion. I think you should see my screen now. Are you able to see my screen?
Yes, we can, but without your PowerPoint presentation.
So I think it should be at the presentation mode now.
Okay. We are not seeing it in the presentation mode. We are seeing it in mode that you have with your two monitors on.
Oh,
if they're going to display settings to set it for viewing for presentation mode.
So just hold on, coming. I will need to just give me a moment, please.
Sure.
So can you see it now?
Yeah.
Yes, we can, sir.
Yeah?
Yeah.
Yes, we can.
Okay. So let me just be sure that it's not, it seems it's not moving. It's not moving. Sorry, please. Just, I don't know why it's not. Sorry. Can you see it now?
Yes, but you can put it in the full screen.
Sure. Yeah, that's what I'm trying
the down button.
So my name is Uzairue Leonard, and I will be making a presentation on developing robust eligibility criteria and having an effective, how to also get to have a very good selective process for systematic review and meta analysis. So before we go into what we are here to here today, so basically, I would just want to, I know we've gone through what a systematic review is and what a meta-analysis equally mean, but basically, I just want to take us through some few definition, what it means to have a study that meets the criteria for a systematic review. So when we talk about a systematic review, it has to do with a study that is done that involve a comprehensive and equally involved a systematic way of doing about 4 different things. The first being the selection have to be done systematically. Also, the identification of the studies that will be involved in whatever you're going to do will also have to be done systematically. Then they have to be a critical appraiser too, and the synthesis of the evidence that you are going to have will also have to be done in a systematic way. So it therefore means that if any of this process is not done systematically, you can't attempt to have done a systematic review. It's possible you have done a scoping review. It's possible you have done a narrative review. It's possible you have done maybe just a literature review, but you've not done a systematic review. So for you to be able to say that you have done a systematic review, there have to be a systematic and a comprehensive way of identify whatever studies that are going to be involved, the selection of those studies, appraisal of those studies, and equally the synthesizing of the findings that are going to become the body of evidence that you have will have to be done systematically. So therefore, me, there are basic few characteristics which I believe you must have also be taught, that you have to, before you do a systematic review, you must have a predefined protocol. So it means that you cannot just stand up today and you will start a systematic review now and also finish it now. It's not possible. You have to have a predetermined protocol. So it means that the method that you're going to use will have to be predefined. How you are going to search the literature that will be involved in the study that you are going to be, that will be included in your study, will have to be done in a systematic way, and the protocol will have to be developed, pre-developed even before you start the actual process. Then also the searching, like I mentioned, have to be done in a systematic way. Then what we'll be looking at today, there have to be an explicit eligibility criteria that specify what is going to determine what will be the study that you're going to be involved. And also you have to define a framework upon which the appraiser of the study that you're going to be, that will be involved in your method, will also be included. Then there has to be a method of systematically synthesizing the results that will be involved, whether be a qualitative or a quantitative or a mixed method study, as the case may be. So then we also have to look at the statistical aspect of a systematic review. So it therefore means that a systematic review can be done with or without a systematic, without a meta-analysis then. So when you hear meta-analysis or statistical analysis or quantitative systematic review, we're actually talking about a systematic review with meta-analysis. When you hear a quantitative systematic review. So, but when you just hear a systematic review, it means that it could be without a meta-analysis. But once you hear a systematic review that is quantitative, then we are talking about the meta-analysis with meta-analysis. So a meta-analysis is actually the statistical aspect of a systematic review, which involved the using a systematic way of a statistical method to synthesize those results for you to have a common outcome. So it therefore means that for a systematic review that have to be involved with a meta-analysis, there are certain criteria too that you must also look at for. It therefore means that the studies that you're going to include have to be studies that have similar outcomes. So it therefore means if a study, for example, is looking at, using agriculture as an example, is looking at an effective way of impact of mechanization, for example, on agriculture output in a certain season, but you already got in studies that have looked at this outcome, improve outcome, whether improve yield or increase in farm produce of whatever output you are looking at. But you cannot include a study that is, for example, looking at how mechanization affects, that is the impact of sustenance on agriculture. But when you are, because the two outcomes you are looking at are different. So it therefore means that for you to be able to determine a statistical synthesis of a systematic review, the outcome of those studies that are involved have to be done in a way that that you will be able to synthesize the outcome together. It therefore means if the outcome are not the same, you cannot include those studies into it. So that is very, very important. So we also need to note that it aims to provide a more concise estimate of the effect. Now, probably there are studies that have been done, for example, looking at, let's say, how the use of antibiotics, for example, has increased AMR. Now, let's say in Nigeria. Now, there are a lot of studies that may have looked at those different outcomes. But for you to be able to look at a generalized outcome in terms of looking at a holistic view of a single outcome, you have to do, especially if it's something that has to do with a numeric outcome, you need to look at, do a kind of an estimate. And that estimate, for you to do that estimate, you need to do a meta-analysis. So basically, why do we do a systematic review? I think this should have been things that has been mentioned to you. The first thing is that it actually provides the highest level of evidence for informed decision. So whatever profession or career you belong to, once you need to make a decision that require an evidence, systematic review and meta-analysis is actually one very important way through which you can look at. You will be able to decide on the evidence that you're going to be using to guide your decision, if it's going to be if it's an evidence that can be depended upon. Now, for example, if you are making a decision, and let's assume that your decision was based on a study, for example, that was done, a single study, and someone else is basing his or her whole decision on a systematic synthesis of evidence that is available. The persons that is making decision based on systematic review is actually going to make the highest, going to provide a more informed decision than someone that based his or her decision based on just one outcome. So also, it can also help to resolve inconsistency between individual studies, like I mentioned. Now, why this is important, there are a lot of factors that can actually that can affect different aspects of your study. For example, the study design that these different individuals used could inform could affect the outcome of a study. For example, the eligibility criteria that were used to select the participant of that study could also have impact. Then also the kind of environment where the study was also done could also happen. Or for example, if a study that is dependent on climate, a study that is done in the rainy season is different. The outcome of that will affect the study that was done in a dry season. So those are some of the things that leads to inconsistency in result. Or for example, we are looking at a study that is looking at how people are able to number of steps that people move in a day. Now, if, for example, where the bus stop where these people usually take whether vehicle to their destination, if it's far from their home and they have to walk, you intend to those people intend to have more daily steps compared to those who their houses are close to the bus station. So you can see that a lot of factors we have will actually affect the consistency of an output of result. So it therefore means that for you to be able to make an holistic decision, you need to base your evidence on studies that have looked at all of these factors, different studies that have looked at all of these factors, then that is able to do like a pooled evidence. Based on those evidence, you'll be able to make informed decision. So it can also improve the statistical power because when a single study will look at, let's say, 200 people, but when you are doing a pool of evidence, you'll be looking at maybe like 3,000 individuals that are involved in that systematic review. So whatever outcome you are going to generate will be we have more statistical power compared to just an individual result. So also because of that, you can do a whole lot of subgroup analysis, like I mentioned. Then like for example, when a study, let's say you have a study that looked at several smaller studies that investigate the effect of mobilization on reduced hospital stay, for example, after surgery. Now, when you pull evidence together, you tend to have a better result compared to just an individual result. So now to the meat of what we have to discuss today, which is eligibility criteria and selection, study selection criteria too. Now, we need to know that why do we do all of these evidence synthesis? Why do we usually include what is the importance of eligibility criteria? For example, there are a lot of things that we need to understand. Now, before we start looking at each of these, we need to understand when we talk about eligibility criteria, we are simply talking about certain criteria that you've set in place that will determine if you are going to include a particular study or you are going to exclude them. Now, there are a lot of factors that, and I also need to you to understand that looking at this, every individual, each of the individual results is very, very important. Now, the reason is that for every study that is done, there are also eligibility criteria that are set for those studies. For example, if I'm doing a study on certain age group, now those age group is going to determine what is going to, the participant, the population that I'm going to be studying. So it therefore means that the population that you are going to be including in your study is one criteria that you need to set. Now, also, if the kind of intervention or exposure that you are going to be, that your study is involved with, is also something that is very important that we need to also take note of. So what is the importance of eligibility criteria and study selection in a systematic review? The first is that it helps you to focus and also determine the relevance of whatever you are doing. So if you are doing a study on, let's say, you are doing a study on a particular outcome. Let's say you are looking at malaria in under 5. Let's say the pooled prevalence of malaria in under 5 in Nigeria, for example. Now, it means that the population that you are going to be looking at are children who are under 5. So when you do your search, for example, one of the things that you are going to, most of the study you are going to see that might be included in your search, especially if there are no narrowing of your search terms that were nowhere defined. What is going to happen is that you're going to include a whole lot of other studies that may not be done in under 5. Some may be done, for example, in adolescents. Some may be done in children that are above 5 years, and all of those. So when you are selecting when you are determining your eligibility criteria, the first thing that you need to focus on is to look at, will help you to actually, eligibility criteria will help you to focus and also determine the relevance of those studies. Because if that is not well done, you're going to lose focus. You're going to be including studies and including studies that may not, for example, that may not be eligible at the end, and it's going to also include your labor, because you're going to take time to screen more of those studies, because that will affect the total study that you're going to include, and as such, it will affect the time that you're supposed to be used to be doing other things, you will still be screening title and abstract, because you will include both relevant and irrelevant studies. Then also, it will help you to also minimize bias. Now, before I even go to that, it will also help you to focus your question, and as such, you'll be able to include only relevant results. Now, why this is important? Because your research question is going to determine, for example, your search terms that you're going to design is also going to affect your search, the outcome of your search, which is also very important for you to note. Then the next thing is that it will help you to minimize bias, because you have a clear criteria. Now it will reduce the risk of selecting studies that will not be relevant, studies that are going to that are not going to make meaning to your study. Just like I mentioned, you are looking at the impact of mechanization on, let's say, on a particular crop yield, for example, or the impact of a certain fertilizer on the outcome of a particular yield of a particular drug or crop, for example. Now, all of those will have impact on the kind of study you are going to include, because you will not include study, for example, that is talking about, let's say you are looking at NPK fertilizer. Now, you will not include studies that are talking about, let's say, human study that use human dung as fertilizer. So you see that it will, because your study research question is already focused on NPK, NPK will be part of your search term that you're going to include. So it means that studies that do not use NPK, for example, will not be part of what you are going to look at. Same also, like you're doing a study that is looking at impact of climate on antimicrobial resistance. Now, because that climate is not defined, for example, because or weather, it could be you are looking at rain season, you're looking at dry season, you're looking at, because if you're looking at just weather, it could be rainy season, it could be dry season, it could be humidity, could be temperature. So you need to define what you're looking at. So it means that if you are looking at, for example, seasonality, in terms of rain seasonality, whether dry season or rain season, on antimicrobial resistance, you will be able to focus on that. But when you're looking at, when you have not set a well-defined criteria for your study, you will include studies that are not going to be relevant. So another thing is that it also helps the validity and the reliability of your study, because when you include only appropriate study, what happens is that it strengthens both the internal and the external validation of your review finding. But if you include studies that are not of relevance, what will happen is that the validity of your study and the reliability of your study will be in question. I know what that can mean. For example, if you send it out for review, the reviewer is going to send it back to you, or even though it passed the first stage of, let's say, the editorial review, and they send it out to people who are authority in that subject, they are going to query a lot of things, and at the end, the paper might not be accepted, and it will end up probably publishing that outcome on a mushroom journal. So that is also very important. Also, one thing about science that we know is issue of reproducibility. If you don't use process that can be replicated, very likely that study will not stand the test of time. So also, efficiency is also very important. Like I mentioned, it will streamline time that you're going to use for screening and you're going to use for selection process. If you include irrelevant study, you will spend time fine-tuning your selection and screening, and as such, it will have impact on on the time and also resources. Something that you're supposed to use, maybe do the screening for 1 month, you end up doing it maybe for 3 months. I know that will affect the final outcome. So also, now, what are the consequences of poor criteria? Now, the first is that, like I mentioned, you will include irrelevant studies, which will dilute the findings. Then you also meet key evidence, which will lead to incomplete conclusion. I know that will bring up a gap, meaning that there is need for that research question that you set again to be re-evaluated. Then it will also be subjective selection, which will introduce bias in your study. So now we need to look at the foundation for eligibility criteria. I know you have been taught, for example, different type of framework. We talked about we have Spider, we have Spice, we have PICO, and the variants of PICO, whether PICOs, whether PECO, whether the PICOTS, all the different variables. But each of those criteria are based on a PICO framework that are designed. So it therefore means that if you understand PICO, for example, you will be able to apply them, whether you are looking at Spider, whether you are looking at Spices, whether you are looking at every other criteria that are available that you need to look at. This will be a foundation upon which eligibility criteria is usually set. So the first thing is that we know that PICO is widely used framework for structuring research questions. And when we talk about PICO, we are talking about population, intervention, or exposure. We are talking about comparator. Then we are looking at outcome. Then some of recent, it is now being recommended that when you are doing PICO, you should also include the S, which has to do with the study design. So it means that you need to state the study design that you are including in your framework. The reason why this is important is because, for example, if you are doing a study that is looking at let's say that have to recommend the outcome of your systematic review, maybe for treatment or for diagnostic purpose, for example, a study that is done, for example, that is of that include clinical trial or trial generally, they are according to, there's also another framework for evaluation, which is referred to as grade. Now, grade is the reason why I'm introducing this different term is because you need to understand the importance of study design, because if especially study that involves meta-analysis, if you do a meta-analysis and all your study that you included in your meta-analysis, for example, all of them were randomized trial studies, based on grade, it's already been stated that the outcome of that your result, it can be tend to be highly sensitive. But if all your study are observational studies, now from the very beginning, it is graded as low sanctity. So what that means is that there is need for you to determine to include the study design. So the first thing here is that PICO is widely used for structuring research questions, and also it will help you to develop the eligibility criteria. Then when we talk about PICO, for example, PICO, like we mentioned, is either population stroke participant, we have intervention or exposure, then we have comparator, or then we have outcomes, then we have study design, which is now very important that you need to include, like I stated earlier. Now, when we talk about population, I need us to pay attention at this point in time. Before I will just take out to look at certain example here. Now, when we talk about population or participant, the question that should always be in your mind is, who are we interested in? Now, when you are doing a systematic review, that should always be the question that you ask yourself. Who are we interested in? Or what are we interested? Who are we interested in? We have to do with the population or the participant you are looking at. So the first requirement is that you have to clearly define the characteristics of the individual or group that you are studying. So now let's look at certain specific example. For example, we have age range. Now, if you are looking at children or you are looking at adults at age 60 plus, so it therefore means that will help you to also define, you already know who you are interested in, who population are you studying? Then also population could also mean specific diagnostic or decision. It's not only just individuals. It could also mean certain group of people. For example, people who have type 2 diabetes. Now, I also need to mention, because I know we have different category of people that are here. Like the issue I mentioned concerning agriculture, for example, it could be you are looking at, let's say we are looking at the impact of, let's say, the impact of a particular climate on the productivity of certain animal, for example. Let's say you are looking at productivity of cow. Now, those cow, for example, becomes your population you are looking at. Now, another example could also be the issue of farming, that I mentioned, mechanization. Now, if you are studying mechanization, it means that the participant or the population of farmers that you will be studying are people that are involved in mechanization. So the reason why I'm using all of this example, because there could be category of different people that are here. Now, it could also be, for example, you are doing a study that have to do with business, and in your study, you already defined that the population of people you are looking at people who have the business you are studying are businesses that have, let's say, that have only 2 to 20 employees, or have more than 20 employees. So that becomes the population of your study. Now, another thing is also, it could also be the severity of the disease you are looking at. Now, it could be you are looking at, for example, people who have, let's say, mid to moderate asthma, or people who have an early stage cancer individual. Now, it could also be you are looking at comorbidity. You are looking at people who have patients with diabetes and hypertension. Now, diabetes is is a condition. Then hypertension could be the comorbidity, or in other case, the hypertension could be the condition. Then diabetes could be the comorbidity. So just in those instances, because population could mean different things. It could also be demographic. You're looking at gender, you're looking at ethnic group, and all of those. Then it could also be a setting. Let's say you are looking at primary care, you are looking at hospital, you're looking at community, or you are looking at people who do sustenance agriculture, for example, or people who do mechanized agriculture, or people who do crop agriculture, or those who do animal animal husbandry, or animal agriculture. These are going to be example of the population. Now, let's take this example. Now, we could be looking at a broad example. Could actually be something that have to do with individual with heart disease. Now, another thing could be that we also have specific age group. It could be individual with age 50 to 70 who are diagnosed with stable coronary artery disease. Now, that is an example. Then another one could be you're looking at people, let's say, looking at people, for example, who take certain vaccine. It could also be animal. Let's say there is an outbreak of a particular disease on animal group, and you want to look at how is the vaccine that have been produced, how is the effect that you're looking at it. Now, we could be looking at two populations: people who are diagnosed with a particular condition, or people who are not who are not diagnosed with the condition, but that have a particular condition, or that have taken a particular vaccine or not. So those are some of the things that you could also consider. Now, when we talk about intervention, the next thing about intervention is what is being studied. Now, you're looking at what are you studying. You have to clearly look at the intervention, the exposure or treatment of interest that you're looking at. It could be, for example, the type of intervention could be, for example, when we talk about pharmaceutical, have to do with something that relate to drug. Then it could be behavioral. For example, you are looking at, let's say, people who attend body school, for example, compared to those who do not have attend body school. What is their attitude towards study or towards night reading? So those are all those have to do with behavior, or it could be something that had to be surgical or education. People that are private that attend there, for example, people who undergo certain education, who were treated with certain education, and those who were not treated with, who do not have certain education. Let's say people that have a formal education. Let's assume you are trying to look at people who attend formal education and those who do not have attend formal education, or a particular intervention. Let's say there is an education on how to handle a particular, how to prevent a particular disease. Now, there are two groups. The intervention group, those that were the education were given to, that is the intervention. Those who have the education, and those who had the education are those who had the intervention. Or people who, another thing could also be, let's say, a drug or duration. For example, let's say someone took Panadol for 2 hours, then another took for 2 days. Now, those are different interventions that you are looking at. You are looking at the dosage, you are looking at the frequency, then you are looking at the duration. So in this case, there is need for you to be specific on what you are, to be precise on the dose, the frequency, and also the duration, and also the particular drug that you are also given. Then another thing we also need to look at is, it could also be the component of a complex intervention. Example is, for example, when you have a multi-purpose lifestyle intervention, which has to do with, let's say, the person, when we're talking about multi-component, we are talking about, let's say the person is being given education, the person is being given drug, the person is being also, let's say, also have another kind of intervention, let's say exercise, for example. Those are multi-component, not just only one intervention. But another thing we also need to look at when we talk about specific to lifestyle could be, this person does not smoke, this person also usually do exercise, and this person also drink a lot of water. So those are 3 multi-component lifestyle, for example. Those are example of multi-component lifestyle. Or you have an animal, for example, who is put in an environment where they are not allowed to go out. They are in a secluded environment where they are not allowed to go out. They eat, the food they eat are provided by the farmers. They are restricted to location. But those is also a multi-lifestyle, because they don't eat what they want, they eat what they are provided with. They also don't have the ability to walk around. Then also their movement is also limited. Then also, we also want to check route of administration of drug. For example, a drug that is taken by oral or intervention, so this is also intervention. Then timing of intervention to matter. Is it an early intervention or a post-diagnostic? Was the intervention given before the person was diagnosed, or the intervention given after the person was diagnosed? So example is, for example, a broad example could be when you look at an exercise intervention. Because there is no specific exercise that is mentioned, that is more like a broad intervention. But when you say, let's say, a specific intervention, yoga for example, or the person do swimming, those are specific exercise. So a specific one to, like I also mentioned here, could be a supervised aerobic exercise training for at least 30 minutes, 3 times per week for a minimum of 12 weeks. You see that there are specificity in everything that is mentioned. The kind of exercise that the person undergo is mentioned is aerobic. The number of time duration is 30 minutes per day. No, not 30 minutes 3 times per week for a minimum of what? 12 weeks. So you can see there is specificity in this. So when we talk about intervention, is what is being studied, not the outcome. You must not, that's where people also made mistake. You don't confuse intervention with outcome. Intervention is what you do to have the result that you are looking at. So it's like, for example, you do A to have B as the outcome. So that is also very, very important. Then we have comparator. When we talk about comparator, is the intervention being compared with, like a control. What are you comparing the intervention with? Are there defined control, or are there alternative control? For example, it could be you are comparing an orthodox treatment, which is like the intervention. Let's say you are comparing it with, or let's use, let's say the treatment, the orthodox treatment is the control, while an herbal treatment could be, for example, the intervention that is being compared, that is being investigated. So the control is like an alternate intervention that you are comparing the original intervention with. So there are also things that we need to consider here. It could be, for example, a principle. For example, you are doing clinical trial, whether for human trial or animal trial or whatever they are, they have to be something like an innate substance, a substance that does not have, that is known not to have a certain effect on what is being looked at. So the next is also, there could be, you are looking at a standard of care. For example, there is standard of care for tuberculosis, for example. Now, an intervention could be a new drug that has just been developed, but the standard of care could be the already known anti-tuberculosis drug that is available, that is presently being used. Or for example, let's talk about, let's say HIV, for example. The standard of care, there are drugs that are meant for standard of care for, or standard of care for HIV, whether drug, whether lifestyle, and all of those. But the intervention in this case could be a new drug that has just been produced. So when you are comparing standard of care and established method, when we're talking about standard of care, it's like an established method. You are comparing it with a new care that is just being produced, or it could be no intervention at all. This one, there is no, you are not introducing any intervention. It's just like an innate control. You are using it to compare, or an active comparator, another intervention that is being treated. Let's say you have 2 drugs, you have an intervention, then you have another drug that you are comparing with. So in this case, there are 2 interventions, but you are comparing the 2 drugs, trying to check if one drug is more effective than the other. So what you do in that case, one will serve as intervention, while the other one will serve as comparator or control in this case. Then different formulation of drugs too could also be an example. And also comparing, for example, using mechanized means of agriculture with just a sustenance using traditional tools could also be an example. Or someone that went to, for example, you are trying to check how the impact of business school on business, on art, or the output of the resources that or the income of a business, trying to check the people that went to business school, for example, at the end of the day, do they generate more resources than those who do not go to business school? So those that went to business school is the intervention, while those that do not go are the control. So those are different means through which you can actually use to look at that. Then outcome. Now this is what you are interested in, the outcome of interest, the results is of what you are looking at is the output. For example, the reason why you are introducing the intervention could be to check, does it reduce hypertension? Does it reduce blood pressure? If you introduce mechanization, does it increase the yield of the farm? Or if you do, and you know, when you are talking about that mechanization now, you look at using, let's say, using oh, sorry. Please, can you still see my screen, please?
Yes, we can.
Okay.
Yes.
So, okay. So, like I mentioned, even when we talk about mechanization, for example, when you are comparing, you will not say because machines are able to clear 10 acres of land, you will not be comparing it to the sustainable one plot that a farmer. No, that's not what you're going to be doing. You'll be comparing a plot of land that was done mechanically compared to a plot that is also done sustainably, that where all the traditional method of farming were used, trying to check the yield there. How are they better than the one that was done sustainably, or the nutrient? If you want to now go deeper, you now do biochemical analysis to check the nutrient of the same crop that was planted in the mechanized one plot compared to that was planted on the one plot sustainable, or the volume. Checking, for example, if you are looking at cassava, the ton that was produced by one plot from the mechanized farm compared to the ton of cassava that was also produced by one plot in a sustainable. So when you are talking about tons now, that's the outcome you are looking at. Now, when you are talking about, let's say you are trying to check the effect of a particular drug on blood pressure, on the blood pressure is what you are looking at, or blood sugar is what you are looking at. So those are different outcomes that you can measure. So there are actually types of outcome. There's what we call the primary outcome, which is like the primary study primary outcome of what your study is looking at. Now, there are other things that at the point of your observation, you're able to also see those other outcomes. So those will serve as like your secondary outcome. Now, because of time, we'll now look at study design. Now, but this used to be optional, but it's now being recommended that you must include them in your study, especially when you are looking at interventional study. Now, I also need to mention that in the hierarchy of evidence that are produced by randomized clinical trial are usually referred to as the gold standard for interventional studies. So if you are looking at interventional studies, if the study you include are not randomized clinical trial, the outcome of your evidence cannot be said to be a gold standard. Now, what will only make that evidence to be of gold standard if the effect that is generated is something that cannot actually be waived off. So it is very important we note that. So beyond PICO2, we're also looking at, you look at language, you look at publication status, you look at framework, then you also look at settings. So those are other things that you also need to look at when you are defining your eligibility. Now, if you are doing a study that is only, those are a study that we are published in English, there is possibility for bias, because there are studies, for example, that might be published in Chinese, that might be published in French, that might be published in the other different languages that are not English, that may have outcome that would have impact your result. So it is important. That's why in very large systematic review and meta-analysis studies that are published in journals like Lancet and the rest, you usually have people who also look at studies that are not originally published in English, who are able to translate them into English so that you will be able to look at them holistically. So that is also very, very important. So another thing we also need to look at is specificity and sensitivity. Now, why it's very important when you are doing your study, there is need for you to balance specificity and sensitivity. Now, when we talk about specificity, is how the criteria that you set are able to exclude irrelevant study. So a study that is highly specific, for example, would be a study that is able to remove as many irrelevant studies as possible, that only have few irrelevant studies. But the issue here is that in the bid of wanting to remove as many irrelevant studies as possible, you will include studies that are, you will miss studies that are relevant. So why, when we talk about sensitivity, this is actually have to do with how well your study were able to include as many relevant studies as possible. So it therefore means that a study that is highly sensitive, we have a criteria that capture more relevant study, but may also include more irrelevant study, increasing the workload. So a study that is highly sensitive will include as many studies as possible, but the issue is that it will increase your workload. But why a study that is very specific, we include, we remove as many irrelevant studies as possible, but in the bid of wanting to remove as many relevant studies, we now include, we also miss out some relevant studies. So there's usually a trade-off. Now, a trade-off is like balancing both specificity and sensitivity. So it means that as much as you are trying to remove irrelevant study, you should make sure that it's done in a bid to make sure that sensitivity study that could also be important are not missed out. So this is very, very important. Example that I actually gave here is, for example, when you look at randomized controlled trial of cognitive behavior therapy that is delivered face-to-face by a certified therapist for adult with a primary diagnosis of generalized anxiety. Now, what this study is very specific. Now, what is likely going to happen here is that this study may miss out online CBT, the online study that also delivered the same intervention, but that were done online, or study that use both combined, that use both face-to-face and also online. So that is a highly specific study. But a high sensitive study in this case will be a study that evaluates any psychological intervention for anxiety in adults. You know that this study will include both those that are relevant and those that are not relevant. So it's very important that you balance specificity and specificity when you are developing your eligibility criteria. Now, this is actually where it comes in. It's during the development of your eligibility criteria that you do all of those. Now, another thing that I will quickly mention is that you must make sure that you document your eligibility criteria. And one of the ways through which you do this is to make sure that you register your protocol. And the reason why you do this is because it will help you to be able to do certain things. Now, because of time, I'm quickly going to move from here. Then I will go through to my try to go online. Then in the bid of looking every other one, then we'll look at the selection. Now, I'll quickly go through this. Then we'll just do a kind of a practical session where I will show you a paper that was published and how the eligibility criteria was set. So I would quickly want to look at how selection is done. So usually when you are doing a study, the study selection process usually involved when you do a database search, which I know that is going to be your next session. Then there's also need for you to now you do your screening of the title and the abstract. There are usually two levels of screen. You screen the abstract and the title. Then the second level is when you screen when you look at the full text. When you look at the full text to be able to know study that actually mean. Now, where you actually really subject the study to the eligibility criteria are usually 2 levels. Now, the first level is when you are doing your abstract and your title and abstract screening. When you are doing that, for example, what happened at this point is that any study that does not include relevant to what you are looking at, you remove, that are not in the title and the abstract, you remove them. But some of them might be that you might still see the title capture what you are looking at, but when you go in depth into the full text, you will see that the outcome of interest or the population of interest is not captured. So that too we have to be removed. So it is very important that you also note that. Then before you now look at study that you are including. So like I mentioned, the first screening is usually you do the abstract and title and abstract screening. Now, at this point, you must I need to mention something, although I know that probably as you progress, it will also be mentioned to you. At no point should one person do a systematic review. If an individual do a systematic review, there is likely going to be bias in that study. Now, the reason is because there have to be two independent screening that in the reviewers that will look at the study that you are including, that will be able to determine at every point in time if the study that the two, for a study that you are going to include, have to be a study that both the two reviewers agree that they are important. And when there is a disagreement, there have to be kind of a discussion or a third reviewer who is more knowledgeable than the two of you to actually break the tie in this case. Then also, for a very large study, there's what we call inter-rater reliability. Now, for this inter-rater reliability, there's actually a statistical method that is used. There's what we call cohort keeper statistic. Now, if the two reviewer outcome agrees, there will usually be a strong agreement between the two of them. But for a study where there is a lot of this discrepancy, you will notice that they will have low agreement within the two raters. So this is very, very important. So now we'll quickly look at, for example, let's look at this. Now, let's look at this example, a review on effectiveness of yoga for reducing symptoms of depression. Now, the eligibility criteria here specify that the adult must be 18 years, diagnosed with depression using a certain criteria, either DSM or ICD criteria. Yoga as a primary intervention compared to a control group that is using usual care or without outcome. Then the outcome is to measure the severity using a standardized method. Now, let's look at this example. And I'm going to, after now, I'm going to go to some other example, and I will expect you to tell me what they are. Then we'll see the result. Now, the first title here said, the effect of yoga on stress in health college student. Now, this is a wrong population. Now, you are going to exclude this kind of study. Remember that we said they have to be people who are diagnosed with depression, not healthy individuals. Now, this second one said a randomized control trial of yoga versus medication for major depressive disorder. Now, this is also not very clear, but you could include them potentially, because when you look at the full text, it will let you know whether it is something that you are going to include or you will not include. Then the next one is mindfulness and exercise for improving mood. Now, when you look at the full text here, you'll be able to determine if this is something that you are going, because we are not sure whether it's among diagnosed individuals. They just told mindfulness and exercise for improving mood. So mood rather. So when you look at the full test, you'll be able to see what the result actually is. So the next one is experience of yoga practitioner with anxiety. Now, you are not looking at practitioners. So this study now, you will exclude it because you are not looking at practitioners. So there's no need to even want to look at the full test because it's not relevant. Now, it is very important here that you can see how this title relates or does not relate to the criteria that were set. So it is very important that you set a criteria that you can easily subject your subject to, and as such, you will be able to look at. So now, this is a study. Now, I want us to unmute and let's just discuss it before we move to our final output. So can anybody look at this this particular example? I don't even. So can anybody look at this and tell me why this should be included or excluded from the criteria that we've set earlier? From this criteria that we've set, this is the criteria. Now look at this criteria, then look at this and tell me why we should include or exclude this particular study.
Would have been easier if the criteria was on the same page with the question.
Okay, so okay, let me see. Just you give me a minute. Let me copy this and see if it's something I can. Okay, I'll give you time. I'll give you time. Take out the criteria that they set, then we'll go to what we are, the exercise we are going to look at. Because if I want to start editing that now, it will take time, and I feel that because I know I'm to finish. I'm already about, I have about 10 minutes to go before we go to what we need to look at. So I expect that you should have either screenshots or whatever that you need to do. So let's go to the next. So looking at this, if you say it should be included or excluded, can you unmute and tell me the reason why we are including or excluding this particular study? Are we there?
Yes, sir. For what I read,
Okay.
Adults 18 plus, and we have adults 18 plus, and
Who is speaking, please?
Laima
Okay.
is, thank you.
Okay.
And the diagnosis with depression using DCM.
Mm-hmm.
One shows DSM. I think it should be okay.
Yeah. This is just a subtype of the DC. DC might have different subtype. DSM1, DSM2, DSM3, DSM4, DSM5. So go on.
Sorry, that's how far I could go.
Okay. So any other person that want to try?
Hello.
Yeah. Hello.
This is Julianne.
Yeah.
I would say I would include the study because it's looking at adults aged between 25 to 45. Our criteria was 18 plus.
So population meant. The
Yes.
criteria for population meant. All right, go on.
Then they had mild and moderate depression, which was done by DSM-5, which was also the criteria of what you were to use to look at.
Yeah.
Then they have either 8 weeks of weekly yoga or they're in the wait list control, which also meets part of the criteria. Then also the severity was measured using the Beck depression inventory, which I think, I'm not sure we specified that.
Yes, go on.
Just like that 8 weeks, so I would include the study.
Yeah. So very, very correct. So that was why it was included. Sorry. So likely include. So for this second study, can someone look at this and tell me what the outcome using the same criteria? Are we likely to include this or exclude this?
It doesn't seem so.
So it doesn't. No, if yeah, you could be correct. It doesn't seem so. So what reason? Because anybody can say, okay, include. Don't is the reason that you are stating that will determine to know if your reason is cogent or not.
Yes, sir.
Go on.
From the eligibility criteria we have,
Yes.
The age is not stated.
Mm-hmm.
And the diagnosis is also not clear
Stated.
there.
Mm-hmm.
Yeah, stated. And even though the the intervention is there, which is yoga,
Mm-hmm.
and there isn't any group it's been seen to be compared with.
Okay.
Stated here.
Okay.
And I think that's what I have to say. Thank you.
Is there anyone with different view?
Okay, I want to add, Doctor.
Okay.
Okay, everything. The population is broad.
Mm-hmm.
It is not. Someone may be below 18 years may be included. So the intervention is also not clear because it doesn't give the comparator and the standard.
Yeah.
Okay?
Yes.
And the outcome.
Mm-hmm.
The outcome is also broad.
Mm-hmm.
Experiences.
Mm-hmm.
Be negative, could be positive, could be, or anyone could describe it differently. So it's also broad. So it's not so specific, general to say. Thank you.
Okay.
All right. Just to add that this study is specifically looking at people that use yoga to manage their mood. That is not our interests. So this, I'm thinking this should be excluded, just like this.
Okay. So let's see. Good. Wrong study design and outcome. So the population is wrong. The study design is wrong. Now, nobody actually mentioned the study design. This is a qualitative interview.
Okay.
So the study design is wrong too. And the outcome, like all of you has stated, right, is also wrong. So let's see. So this.
What should have been the study? Excuse me, Doctor. What should have been the right study design?
Now, this qualitative interview basically measure life experiences. It's more of kind of it's not diagnostic. For you to measure the parameter that was mentioned, it has to be a kind of a quantitative study, because there is a questionnaire that you'll be given that you will, and then there are scores that are attributed to whatever you feel on those questionnaires. Then based on that questionnaire, you will now be used to grade. You will be graded to know whether you are severe, the person is having severe depression, moderate depression, or low depression, or no depression at all. So you can't use qualitative interview to measure that. So for this third study, a comparison of different types of yoga on anxiety level in a general population sample. So should we include this or exclude this?
Exclude. Yes.
Why?
Exclude.
Oh,
why?
Because, hello, sir. Please, it's because
yeah, go on, please.
Yes, the way the question, the topic is appearing, it does not have a specific population based on the criteria we have set. The the outcome is not also specific in terms of the particular disease. And I think those are the things I can see for now. Then there is no comparison.
Okay. Is there any? Okay. Is there any other?
Okay, I've seen.
Yes, sir.
Okay, go on.
Exclusion also. If you look at the PICO framework, the population one, as my colleague has said, intervention is also quite different. This is it's looking at yoga, then the comparator, and also the outcome. Then it's not also a quantitative experiment like you stated in study 2.
Okay, so if there's no other, now you guys are also correct. Wrong population, wrong outcome. So lastly,
the third one is also wrong study design.
Yes, because no, wrong population and wrong outcome. So the population we can't say is wrong. They say general population. Now in that general population, there are adults there. So usually in this kind of study, actually, if I was the one doing selection and I see this study, I mean this one, I will actually say likely, I will actually ask to see the full text. Are you with me?
Yes.
I will want to see the full text of this article. Now, because when you open the full text, some of these you might look at the end, you might see that the within the study, the eligibility criteria that you are talking about is actually meant. There could be a study that actually look at within the general population that look at compare adults to less than 18 years. You know, when they say general population, it could be children and adults. And for when you do subgroup analysis within even this kind of study, you are supposed to also compare outcome in the two groups. So when you look at the full test, there might be possibility to include or not to include. So, but looking at it at the face value, you may just say exclude, but sometimes you may have to see the full test to be sure whether you are going to include or exclude. So that is something that you also need to pay attention to when you are screening articles. Is that okay? Okay, I think someone, Joy, hand is raised. So Joy, can you mute and say what you want to say?
Yeah, good afternoon. My question is that if you look at this study number 3, so if you look into the full text, if you look into the full text, and we now discover that a large proportion of the participants fall within the age group that we're looking for, although it says a general population. But when we look at the full text, but maybe 75% of the participants, they fall within the age that we're looking for. Can we still include such in our selection?
That's why I mentioned you check if subgroup analysis was done. Now, if the result of the general population was just generally presented without a subgroup to differentiate, you can't include. You already be biased. You'll be introducing bias in your study. But if within this same study, there is a subgroup analysis that for example, that look at difference between male and female within age group. Now, it's possible for you to look at the result for the adult. If the result for the adult was presented outside of the children, then you can include the result that was presented for adult, but you can't include the result of the general population. You can't. If it's not stated, if you are not able to bring out result for adults within this general population, you can't present it. Is that okay?
Yes, sir.
Okay, great. So the last.
Sorry, Leonard.
Yes, go on.
This is just a reminder. It's Nafisa.
Yeah,
It's
I know
a
my
reminder of the
time.
time, yeah.
Yeah, I know. So we'll just look at it. Then I will just take them to their group assignments, and because with this, I think we've covered some few. So lastly, this, just look at this and let me know whether we are excluding or we are including.
Theory program of yoga and meditation compared to standard depression to indication. See depression in older adults. Older adults. Intervention.
Okay, I think someone said we should include. Then because of time,
include.
Yeah, you potentially exclude based on age. No, you exclude based on age or intervention if your criteria were narrower. Now, if it was narrower, now if you just say adult, now you need to check if that adult, if it's just only adult, sorry. If it's just only adult, then you can include. But if, for example, you say adult less than 45, now let's go back to the criteria. Now, can you see the criteria here? Now, they say adult 80 plus. So if you are following this criteria, you will include. Is that okay? If you are following this criteria, you will include. But if it's narrower, the reason why I actually put this potentially exclude based on age or intervention. Now, look at the intervention. Standard antidepressant medication. But yoga was not used here. So yes, you can't include. Yoga was not used here. Is that okay? Hello?
We are saying include
but you said a 12-week program of yoga.
Oh, sorry. Yeah, yoga. Then, but we need to look at the intervention. Now, this is intervention. You also need to be very careful. Now, the reason why you can't include this, you can see that yoga was not only the intervention. There was also medication. Is that okay?
Yes. Okay, because not necessarily that yoga is not used as an intervention.
There was, okay. Because this is going to stand as bias. It's going to introduce bias because you will not be seeing the outcome of the yoga itself. Medication will also impact because it's not only yoga you are looking at. So affect, so you will exclude. Yeah, so it's very important you state. That's why you must make sure that your exclusion criteria are well stated. If not, you will include study that you're not supposed to include. So is that okay? So because of time, this is going to be your class activity. Then you will have about 30 minutes to look at it. Then we'll come back and just discuss. Now, what you just need to, I know you'll be having a whole lot of sessions. Some of you already designed your questions. You might have even done search. Then I will need you to look at what you'll be doing so far and develop an eligibility criteria on the likely study that you are going to include. Then when you come, you will just talk me through what your topic is and why you are including those studies. Is it clear? Hello?
You mean, hello?
Yeah, I can hear you, please.
You mean what we had done last week?
Yes, I know. I'm sure that most of you already have a topic. You must have done your search. So I will need you to look through your, go on, please.
Sorry, Dr. Leonard, can I come in, please?
Yeah,
sorry,
go on, please.
Can I go ahead, Nafisa?
Yes, sure.
Yeah, you can go on.
Okay, great. Thank you very much. So regarding the group activity, we have sent the instructions via email. So we want participants to work on the topic that they used for last week's group activity. One of the topics, I mean, they should develop eligibility criteria from one of those topics and research questions. And if for any reason they would not want to use that topic, let's say maybe it's not in their field of interest, they could come up with
they can choose, you can choose any topic. It's not necessarily
come up with eligibility criteria
Then we'll just, once we come back, sorry, Fortune, once we come back, we'll just look at some sample examples, then we'll discuss it so that I will see to be sure what you've gotten a bit of what I've said. We said. Then I'm within the group. Then I'm hopefully thinking that by the time you are finished the whole session, you should have also, will still be available to give a mentorship in terms of probably you are working on something, you have issue with developing eligibility criteria on certain things, then we'll still be available to just give an advice on how to go about it. So basically. Fortune, over to you, please. I think Comfort hand is raised.
Can we get the criteria again?
Hello?
The criteria again.
Hello, can you hear me?
Yes, go on, please, Comfort.
Okay, thank you, Leonard, for the presentation. I had asked a question on the chat box because we've once had an argument. Is it a must that every research or every systematic review should have a control?
No. It's not that. I wanted to come there. Now, basically, there are some studies that are, I mentioned PICO, and I mentioned there are a variety of them. Now, there are most of the studies that have done, that have published, are not with control. For example, you might be doing a prevalent-based study, for example, looking at prevalence of a particular resistant gene on a particular bacteria. Now, in that kind of study, you're not going to have control. So when you are designing your eligibility criteria, what you are going to have, you're going to have what we call, for example, you're going to have, let's say, PI. In the place of control, usually you will put nil there when you are developing your criteria. Is that okay?
Yes, but what if you use a PEO, population exposure and out?
You are well within acceptable range, but you need to now define. Know why it's important in your eligibility, in your control. You need to now design that this is not a case control or a study that involved control. So you need to give that disclaimer. Is that okay?
Okay, thank you.
Yes.
And thank you for that offer that you said you can offer mentorship. I will need your email address, please, or your WhatsApp number, because I'm also working on antimicrobial resistance. I'm studying the impact of antibiotics and environmental.
You don't need to state the topic here. Especially before
no problem.
Before you go and see it published in the next 3 days. So.
No problem.
All right. So no problem. Yeah, my email, I will drop my email. Then no problem.
Thank you.
It's not only for how, we also need the email. So
it's for all of us, so please. It's not just
no
for
problem.
Thank you.
All right.
Please, can we see the eligibility criteria again shown on the slide?
Which of the eligibility criteria? Which one? Is it the one that we just discussed just now?
Yes. For the screen.
Okay. But that's not what you are working on, though. You just use that as a guide, but that should not be that's not what you are working on. Okay.
Yes, we know.
It's there now. It's there now.
Sorry, we will stop here for the questions. We won't take any more questions. We will start the group activity.
Yeah, so you can start the group activity. When we come back, if you have any question, I'm still very much available to take your questions. So I will drop my email on the group, then feel free to reach out to me if there's anything. All right. So we'll be back in 30 minutes. We'll be back in 30 minutes.
No, sorry, Dr. Leonard, 15 minutes, please.
Okay, 15. Okay. 15 minutes. Sorry.
Nafisa, would you want me to go ahead with the
yes, please.
Huh?
Yes, please.
Okay, great. So please, before I create the rooms, I would like to know if there are any questions regarding the group activity, but the instructions have been sent via email and you're expected to answer or input your answer in the Google Doc. So otherwise, if there's no question regarding this group activity, I'll go ahead to create the rooms now.
Hello. I
Yes.
observed that the Google Doc that was sent to me today was the one that we used for week 1. The one for week 2 is not available. What we did on week 2 was not available there. So I don't know what happened, maybe whether they sent different one. So I think you should look at that. So we don't have access to the topic that we work on during group 2 and during week 2.
Yeah, thank you very much. Kindly use the one that has been sent. That's the one that you're expected to input the answer in.
Well, you don't get what I'm saying yet, that the topic that we'll consider last week, we don't have access to that now. And only the one that we look at in week 1 where we only answer, we use the AMSTAC guideline. That's what we have. That's what we have on the Google Doc as at this moment.
Yeah, I'm saying you can still access the one you used last week because you can still access the one you used last week.
I will go back to the previous email and check.
Yes, you can access it, check the questions there, but then the answers or whatever activity you're doing should be included in the Google Doc that has been shared. Okay, so please, if there's another question, I'll just go ahead and create the rooms. So the rooms has been created. You'll see a button below your screen if you're using your PC, or the top left corner of your screen if you're using your phone. So you could join your breakout room. So we still have 34 people that are yet to join their rooms. Please kindly locate the button or option to join breakout room at the bottom of the screen if you're using your PC. If you're using your phone, you would see it at the top left corner of your screen. But if you're having challenges joining, you could just indicate and I can assign you to a room. Join now. You go see mine. You go Jones. Go right.
Can you ask
how participants were reacting? So yeah, now I will give the stage to Fortune to give you announcements. Fortune, can you hear me?
Yeah, I can hear you.
Okay, go ahead.
Thank you very much. Just a minute.
Sorry, Fortune, you're muted.
Yeah, before I give the announcement, I want to ask Dr. Leonard if he has final comments.
Okay, I just want to appreciate every one of you that joined. Like I mentioned, this is not like the last time we'll be seeing. I'm still within the group and on the general group of SRON. So, and by God's grace, very soon we'll be, even after now, we'll be having more opportunity to attend our, I think we usually have monthly development meetings. So on the general group, so I believe very soon we'll be meeting. And also individually, there's any other thing I feel is going to be useful to all of you, I will keep dropping, already drop an email. So if there's anything you feel I need to see, contribute, I'm open, and we'll keep pushing until all of you develop your confidence in systematic review. So thank you very much. And thank you, Nafisat, for moderating the session. Thank you.
You're welcome.
Right.
Just because of time, there are some questions here. Probably on the group, I will respond to some of them. So, thank you.
All right, thank you very much, Dr. Leonard. So yeah, unfortunately, we're not able to take the majority of the questions. We're not able to do the presentation today because we really have to keep the time. But then, like you heard, Dr. Leonard will be sharing the feedback and grading the group assessment. So I've seen a message from TD Malo that the Google activity document is not accessible on the email sent today. I'm not sure why, because all the Google Docs should be accessible. So maybe you could double check the email that you're using. Thank you very much, everybody. Thank you very much, Nafisa. By now, we believe that you had received feedbacks and scores for your formative assessment. We'll be sharing the feedback and grading for the group assessment as well. That's for the second session. For this particular session, we're expecting that the feedback should be made available by the coming week, that's next week. And the formative assessment instructions and submission guideline will be sent today as usual. So I'll just stop to take one or two questions regarding the peer review formative assessment system and the group activity system. So I just want to take questions on those before we close, please.
Yes, Doctor. There's a general problem which I've seen on WhatsApp group, but it has also happened with me. My peer reviewer says the email is faulty and they can't communicate with me. I've not got the feedback. So I think we need to address that generally to everyone and see how we can go about it. Thank you.
Sorry, Dr. Richard, could you come again? I didn't get your question.
The question is, people are not getting the feedback from the peer reviewers despite sending the individual assignments. And it has happened to me, but from the WhatsApp group, it has not happened to me only, it has happened to others. And particularly with my reviewer, she told me that her email is not functional, so she could not communicate. But maybe others have their own reasons. So maybe you can also give a general comment on that, how to solve that, how to address it. Thank you.
Thank you very much. Please, is there any other question on the peer review and the group assessment? Yeah, I've seen the message from Gloria. I'm just going to address them together. Okay, so I assume there are no other questions. Well, Dr. Richard, we try as much as possible to get the result ready on time. The reason why, we've had only 2 formative assessments. So if you've not gotten result for the first summative assessment, it means you didn't submit within the first recommended timeline. And we are still working on that. So hopefully before the end of the week, you should receive result for the first formative assessment. So if you had submitted your formative assessment before 10 p.m. West African time yesterday, should have gotten the result. But beyond that, the result will come later, maybe between tomorrow and Friday. Otherwise, you could check your email again and let us know if you're not still able to receive the result.
I was talking about the peer review, the communication with the peer review, the one which is not so efficient. Yeah, peer reviewer.
Okay. So yeah, if you're not able to communicate with your peer reviewer, just let us know as soon as possible. We'll see how we can rectify that.
Okay.
So I want to say that please the time for the submission should be streamlined so that we know, because I didn't look at when the time was changed from the previous one to another one. So there were changes, amendment to the timeline to the submission. So please let us know the preferred one so that all of us should be able to adhere to it.
Sorry about that. Sorry about that. So the revised timeline is that you should be able to submit to your peer by Sunday, 11:59 West African time, and your peer should be able to make the submission on your behalf by Tuesday, 11:59 West African time. So for the group assessment, like I can see, Rabat, the first assessment feedback we sent the feedback, but there was a revised submission from the group, so we have not assessed submission yet. And as soon as we revise this, we review the submission, we'll send the feedback. Sorry, I have to go. Could we please continue the conversation via WhatsApp or via email? And if we're not able to respond to your emails or WhatsApp messages, we're very sorry about that. We're hoping that before the end of tomorrow, you should get responses to all the queries. Thank you very much for joining, and see you next week.
Thank you very much. Thank you.